Lori. I'm going to be your nurse today. How are you doing?
I'm doing well, thank you.
I'm going to take a physical assessment. Can you tell me your to get in hygiene here before anything else? Can you tell me where you are?
Yeah, I'm at the hospital.
Okay, and your name and date of birth, please.
It's Max 040592.
Okay. Mood is pleasant. Affect is normal. I'd say level of consciousness is alert and oriented ×3. All right. I see you have glasses. Do you have any dentures or hearing aids?
No.
Is it all right if I take your glasses off? All right. I'm going to assess your neck and head and face area, all right? I begin by touching your scalp, okay? Do you feel any tenderness? Okay. Any tenderness here? Okay, I don't see no redness. Skin is warm, dry, intact. Pink with tan undertones. Tan with pink undertones. Any tenderness in your sinus area? Okay. I forgot to ask, do you have any pain today?
Yes, I do.
Do you? Where's that located?
I have a headache.
You have a headache, okay. When did that start?
A few days ago.
Does anything make it better or worse?
Like Tylenol helps it a little bit, and I like the loud noises make it worse.
Make it worse. What kind of a pain is it? Would you characterize it as sharp or dull or?
It's like dull.
Okay. Is it throbbing in any way?
It radiates to like the forehead.
Okay. All right. And on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt, how would you rate this?
About a 4.
Okay. All right, I'm going to look into your eyes, so I want you to look straight ahead. Okay, pupils are about 4 millimeters. Okay, look up for me. There you go. Yep. Pupils are equal, round, reactive to light, indirect, 4 millimeters. Let's see, I want to look at you. Nares are patent. Can you open your mouth for me? I just want to see you. Mucous membranes are warm and pink with no lesions. Looks like you have all your teeth, correct? Okay. I just want to check in your ears. There's no extra drainage or anything. Okay. All right, why don't you go ahead and lay down for me. I'm going to assess some pulses and listen to your heart. All right, so I'm going to raise the level of the bed, the head of the bed to 30 degrees. I'm going to remove the pillow so that I can assess for jugular veins. Can you turn your head that way? Great. Jugular veins are flat. Can you move this way? Non-distended. All right. Get that back up there. Now I'm going to feel for your carotid pulses, all right? Okay. Carotid pulses are 2+/3 bilaterally. Now I'm going to go ahead and wipe down my stethoscope here. Okay, let that dry for a minute. Alright, so I'm going to listen to your heart sounds. It'll take a few minutes. Alright, I'm going to the aortic listening site, which is the second intercostal space on the left side. S1, or the, excuse me, carotid. S1 and the aortic are correlate.
Carotid.
They correlate there. Apical pulse is 80. S2 is louder than S1, and I hear no murmurs, rubs, or splits. I'm coming over to the left, excuse me, yes, the left side. Second intercostal space, and this is the pulmonic listening site. It's regular, approximately 80 beats per minute. S2 is louder than S1, and I hear no murmurs, rubs, or splits. I'm moving down to the third intercostal space, the Erb's point. S1 and S2 are equal. The beats per minute are approximately 80 per minute. And I hear no rubs or splits or murmurs. Now I'm moving down to the fifth intercostal space. This is the tricuspid listening site, which is S1 is louder than S2. Beats are approximately 80 per minute. And I hear no murmurs or rubs. And now I'm moving to the fifth intercostal space, mid-clavicular line. S1 is louder than S2. And I hear no murmurs, rubs, or gallops. Beats are approximately 80 per minute. Okay, while you're down there, I'm going to assess your abdomen. Sit this
Okay.
down. There we go, exactly, thank you. And upon looking at the abdomen, I find that it's symmetrical, non-distended and soft, round. Yes, I'm gonna listen first. Lower left quadrant. Vowel sounds are normal active in all four quadrants. Alright, I'm gonna touch pretty lightly here and tell me if you feel any tenderness,
Okay.
pain, anything?
No tenderness or pain.
When was your last bowel movement?
This morning.
Was it normal? Pretty normal for you? Was it soft or hard?
Yeah, it's
Loose?
soft.
Abdomen is non-tender and soft on light palpation. Do you ever experience any nausea or vomiting?
No nausea or vomiting.
Okay. why don't you go ahead and go up and sit up here for me. We're going to do some lung sounds and your extremities. All right. All right. So what I'd like you to do is to breathe, not too deeply, but a little deeper than usual every time I place this, okay? You feel any dizziness?
Just a little.
Take a little break. Okay. All right, I'm going to have you lift this arm for me. Take a breath. And this one, thank you. All right. Just relax for a second there. All right, now if you could stand for me, we're going to listen to the map. Okay, relax. One more thing I'm going to do, and then you can sit back down. Right, now I want you to take a deep breath for me. Okay. Chest, lung sounds are clear throughout all four quadrants. Excuse me, all fields. And chest expansion is symmetrical. You can do whatever is most comfortable. I am going to, I guess that's the best. Symmetrical and even, and now I'm going to assess your upper extremities, okay? Start by, let's do your skin. I'm checking your skin, it's warm, dry and intact, tan with pink undertones, no redness on any pressure points, no lesions or swelling. Sorry, no lesions or bruising. Alright, let me check your capillary refill is brisk. No clubbing on the fingernails. Let me check your brachial pulses here. Brachial pulses are 2+3 bilaterally. And your radial pulse. +3 bilaterally. Regular. Ulnar pulse is also 2+3 bilaterally and regular. Alright, I'm going to check your blood pressure. And also, while I was checking those pulses, I was checking the respiratory rate, which was 20, which is normal. Very good. All right. Now, do you have a preference of an arm? And have you had any fistulas or surgeries on either arm or chest area?
No.
Okay. I'm going to go ahead and choose this arm, okay? The blood pressure cuff is chosen by checking, it needs to cover 40%. The width of the bladder needs to cover 40% of the circumference of the extremity, and the length of the bladder needs to cover 80% of the extremity. And we're using the two-step process today, okay? But that means I'm going to be checking your pulse and blowing it up once to determine how much I need to blow it up the second time. Perfect. Get this right here. Okay, let me get a pillow for you. How about you rest your arm here so that the arm is a little better positioned with the heart. Good. Feeling for the radial pulse. And I'm blowing the bladder up just until the radial pulse stops. About 120, so I'm going to blow it up 20 to 30 degrees higher. This helps us get a more accurate reading. So I'm blowing it up to 150. Very good, 118 over 80, which is good. All right, get this off of you. Can you lift your arms out to the side?
Yep.
And up over your head there? Good, full range of motion. Right, let me get this pillow out of the way. Alright, we're going to do some grip strength activity. So I want you to go ahead and grab my fingers and pull. And now push. Very good. Grip strength is 5 out of 5 bilaterally. Alright, so why don't you go ahead and lay down for me. And I'm going to assess your lower half. We're going to start by taking your pulses, okay?
Alright.
Alright, we're going to start with the femoral pulse. Okay, they're 2 plus out of 3 bilaterally. And we're going to take your tibial pulses and compare them. And regular and 2 plus out of 3 bilaterally. And we're going to check your dorsalis pedis pulses. this is 2 plus 3. 2 plus out of 3 bilaterally. Can you feel?
Yep.
Have you had any numbness or tingling in your legs? Alright, I'm going to be checking the skin here. Alright, so the skin is warm, dry. Warm, dry, and intact. Alright, I'm checking for edema. No edema present. Alright. Can you push against my hands for me? There you go. And can you pull? Give it a good pull. There we go. Muscle strength is 5 out of 5 bilaterally. There's no edema. Skin is intact. I feel like I'm forgetting something. Okay, so gonna check your movement. Can you move your legs one knee at a time towards your chest, please? Very good. No pain or anything? Alright. Alright, why don't you sit up for me? I feel like I might have forgotten something. Alright, so I would like you to stand and walk over to the bookcase and walk back. Posture is erect. Gait is even and steady. You don't feel any dizziness? Okay, great. Alright, I think we're done. Well, I'm going to go and let the doctor know about your headache, and I'm sure that he'll be in a few minutes to see you.
Thank you.